Hello, viewers. Welcome to our channel 4M USA. You already know 4M. This channel is a US based channel, and we are actually working for mental health. And this 4M stands for mental health, migration, multicultural language, and also mindfulness. We are practicing mindfulness beyond the border. So now today, our another episode we are going to run. We have already mentioned this program's name is Global Mental Health Journey. So in this journey, we will know our mental health specialists or experts who have glorious career in overall the world. So today we will know about another personnel who has very glorious career with child protection and also psychosocial support and mental health. Now I am going to introduce myself. This is Mahmouda. I am also a MSPSS specialist and I am working in international NGO in Afghanistan. So now I am going to introduce our new guest, Mr. Wayne Blair. He will introduce himself and also we will know more about him. Please welcome Wayne Blair.
Hello, my name is Wayne, and I'm a child protection in emergencies and mental health specialist. And I've worked for 26 years in conflict zones, starting in the former Yugoslavia and ending in Bangladesh with the Rohingya. And throughout that time, I've led and participated in many different efforts to help children who've been affected by armed conflict. And prior to that, I was a family and child therapist at a community mental health center in the United States.
Okay. Thank you, Blair. Today, actually, we will ask many more questions, and we would like to know like about your career and starting your education and journey with this emergency complex situation, and especially focusing on the children because this is a big gap in our global mental health journey. Everywhere we are working, especially we are focusing mainly for the adult people and also the elderly people, but we are somehow ignoring the children's part, but they are the base because children also our another vulnerable part of this mental health journey. So we would like to know more about this journey. If you can introduce us at the beginning of your career, how you started with children and also which comes on your mind, how you tried to fix it up and also you spreaded this thing all over the world where you worked, and you were focusing especially for the children part so children can be benefited, and also we learned a lot from you this thing. So please, over to you.
Okay, I started out as a clinical social worker. I graduated from my graduate school in 1982, and I always wanted to work with children because they are, the future. And I realized that children were part of families and communities. So I studied very intensively the different schools of family therapy and trained with all the masters at the time. Family therapy was very popular in the 80s and 90s. And
Mhm.
I was working in a community mental health center in Washington State. I was the child and family supervisor, and I very rarely at the time did I work with individual children. I worked with whole families to help them work with their own children because really children were part of the family, and the interaction around the child often maintained the problems that the child was having. So if we could interrupt that cycle of behavior or thinking or change the narrative of the family, we can often help the child and the whole family to become symptom free. So that was my background, and I also studied hypnotherapy, which is a form of brief therapy, which I used as well, especially with trauma back then. And then in 1994, I got a year leave of absence from my job, and I got a job as a mental health specialist in the former Yugoslavia with International Rescue Committee, and there we used a group approach with refugee women and children, and it was very effective. And from there, I went on to Africa, Asia, and
Mm-hmm.
for the next 26 years, and
Okay.
worked in many different conflict situations.
Yeah, okay. Thank you. When I am interested a little bit know more about the how group therapy works actually, because for the children it is a bit difficult, no? And also for the children, which age range, especially either the 5 to 12 or the adolescent one, 12 to 17. How did you arrange this, and how family? And if you can give us some contextual evidence or example, especially where it was really so difficult to implement according to your experience.
Well, I don't think it was. I think the difficulty was in getting people to come at first because they've never had done anything like this. But
Mhm.
it became very important, for example, especially with refugees, to maintain their culture and to participate in activities and rituals they did at home that they were no longer practicing in exile. So when I was in the former Yugoslavia, we did groups that we tried to incorporate the cultural rituals such as cooking, storytelling, all the things that would bring back positive memories of their home.
Mhm.
And I did that in with the Rohingya too. I really believe that people can't settle into their new context unless they have a positive feeling about where they came from. And when they flee under terrible conditions and often have are focusing on only the negative experiences. So part of the things I like doing is trying to remind them, help them remember one of the things they used to do that gave them meaning and structure, and also have them practice that in their new environments. And I
Mhm.
find that that really helps people
Mhm.
deal with whatever issues they've gone through. I think groups are important because it's really only in the West that individuals are prized, you know? Most people in other
Mhm.
cultures view themselves as part of a group, a part of a family, part of a community. It's not like Freud, where people come and just talk and talk to a special
Mhm.
person.
Yep.
Or in my country, where people are isolated and need a therapist to feel a connection because they don't want to burn out their friends. So I find that that's most of the therapy that we practice is for Western populations, and we have to make new or at least rethink that when we're working with more communal cultures where people define themselves in reference to the group rather than the person next door. So
Yeah.
I find that the groups were really important and people can relate and find support and find that they're not alone. Everyone is experiencing similar issues and they can come up with solutions on their own. You know, rather than me be the expert or the therapist be the expert, it's you ask the people how they deal with these things, how they dealt with them in their old country. Because many times people forget what they used to do that worked in their own country and when they come to a new place. So those are important things for me. I think with the Rohingya, it was really important to. I pushed UNICEF at the beginning that they needed to hire Rohingya people because they knew the language and they knew the culture, they knew the stories, they knew the songs, and which are very important to them. And it you could see the children just light up when you did that. When you had somebody from their own community, when they sang the songs that they used to sing, it was very powerful and told the stories.
Mhm. Yes, actually, children learn from this environment, peer groups, and also together they can create many more things. Especially the stigma, it helps to reduce. Like we are not alone when they are coming in child-friendly space. They can learn and they can know themselves. They can discover themselves in a different way. Okay, this is how we can accumulate ourselves, and also it is the base. They can increase their self-esteem, they can learn leadership skills through this group. I also do believe like group therapies also works really better in this context, especially in this humanitarian crisis situation. uh, so thank you, Wen. And also I am interested a bit more, like you are also working with protection and also child psychosocial support. So can you give us like a unique example, like how changes comes? It could be in different setting in your working area, so that we can also know like how we can implement, how we can work with them. Thank you, Gwen, please.
I think one thing I want to say before I is that the most important thing is how do you create a safe environment where people feel safe enough that they can express themselves without being um, criticized or judged. That
Mhm.
is the most important thing with children
Mhm.
is that there is a safe place for them because they're coming from unsafe places, and that is probably one of the big powerful qualities of child friendly space. We try, some places call them safe spaces, but we try to create a safe place for children to express themselves and to
Mhm.
be mentored by other people. I think the one of the most amazing things I saw, and I was, asked about this by many journalists, was in the child friendly spaces in Bangladesh. Since people didn't necessarily know the language of children, because at the beginning, most of the people who were hired were from Dhaka and they didn't speak the local dialect, which was similar to Rohingya. So I found that letting the children draw freely in a safe place allowed them to work through the trauma they experienced in Myanmar. And it was pretty amazing over time to watch the changes in their drawings that went from war to then the camp and the child friendly space to flowers. It was really interesting. And I taught the facilitators in the child friendly space how to respond to these drawings, to ask questions, not to interpret them, and let the children express themselves. And that was really powerful. I could see the changes in the children as time went on. And I saw the changes in their affect and their mood as well. So, that was a really nice example for me of how
Mhm.
giving people a safe space and the ability to express themselves in a safe
Mhm.
environment help them recover.
Mhm. Yes, this is the fact. Like for children, we have to ensure their safe place, and so that they can feel comfort and they can express themselves without fear, because they need this environment. And also, I can give you like one example I can share with you. Like at the beginning of the influx in that community, I also had the similar experience. Like few children, they had very severe, complex, traumatic event in their life, and few of them they have seen like in front of them their mother was like raped and father was slaughtered. So these types of incident happened, and later on when they reached in the Bangladesh, they could not speak. They are like overwhelmed with this significant traumatic event. So this is terrific for them. But what happened? We just created a safe space for them with other children, and then their you already mentioned language is a barrier, definitely. And that time we tried to promote, like, okay, to get back from their curriculums, schools, rhymes, songs, so that they can still feel like ownership and belongingness of their area. And then they started with play, with some sort of rhymes, national anthem. So they started within few days. We could see the change, because they feel that, okay, now I can sleep, at least I have a place where I am safe and no one is like threatening me. I am not being died enough anymore. So it was the scenario. But for the children, as I already mentioned, this is a big gap, huge gap. We cannot do much more things. Everyone, like for mental health especially, we are telling this is post emergency, this is not like the emergency part. So we are always one step behind. So when we are starting working, mostly we are focusing, like especially target group, the adult, though we are not mentioning especially, only we are focusing. But there are many things happening here: resources lacking, and also funding, budget, specialist, technical support, everything, like we have this lacking. So in your views, like you worked especially with children, what could be the good suggestion to like extend, or do you think we should incorporate with adults, so that a special segment always can be implemented with other mental health parts for children? What is your thinking, and if you can give us these ideas and examples?
I think it's always good to incorporate, as many people as you can. And I often, of course, you need to look at the culture and incorporate the community leaders and the religious leaders, especially, because we know that religion, in its positive way, promotes resilience in children. It gives them a reason and people a reason, an explanation for why bad things happen. So it's very positive, and that was very important in Afghanistan, in every country I've worked in, Lebanon, in Bangladesh, to work with the religious leaders and understand, because those were the ones that people go to in South Sudan as well. Those are we trained all the Presbyterian ministers in psychological first aid and also children's mental health. So because they were the ones people were going to. So often mental health, we think we're the only people, but really the community, the leaders, the religion, that's the main mental health and extended families, mental health providers, really. So it's really important to work with them as well and help them to help their family and their community. Because really a structure in a camp can exacerbate whatever issues are there. With children, one of the most important things is structure. After a crisis, the family rituals go the wayside and it's like more chaotic. So for me, when I supervised the child friendly space, I made sure there was a strict structure. So we had a greeting, we had different activities in different parts of the room, and then we had maybe a relaxation or mindfulness exercise, and then we would have a going away ritual. So when the kids left, they felt good and they weren't also so excited that they got in trouble. So for me, that's really important. Reestablishing rituals and providing rituals for children, such as they can predict what's going to happen so they can develop trust again. One of the things I did was we had a set structure in those. Every 15 minutes was a different activity and it happened the same every day, because it's people develop trust through predictability. So if they knew what was going on, they would develop more trust and feel more secure and open to other things. So I think for me, I like to demystify mental health. I don't think you need to be a psychiatrist or a PhD psychologist or whatever to provide mental health. I think we all can do that, and we all need to know the signs in children when they're upset and when they're not. You know, if they're withdrawing or if they're expressing negative thoughts. We have to know what to do when that happens. And I think one of the main things that I have pushed, which is to teach people about suicide prevention, because refugees are high risk for suicide, so are adolescents, and the age is going down around the world of children who attempt. So for me, that's another big thing, is teaching that suicide prevention and how do you recognize a suicidal person.
Very
And
good and important points from you.
mhm.
Especially as you mentioned, like community people are the main resources for like child protection or child mental health services, because they are the main sources. You mentioned very important thing, that is like to provide child mental health or psychosocial support. It is not necessarily like to be a psychiatrist or to be a PhD psychologist or an applied one, but at least we should have the basic skills to understand, to know the child psychology, child science. This is the important thing, like how we can uh, do these things. So it is our important thing. First, like we have to understand the child psychology, and then if we want to implement anything, we need to know actually like how we can do these things with the community. And community people are also the main religious leaders, community champions, community influential people. They can actually help us in this ground. That's great. Great to know you from them. Okay, when I think like someone from our viewers, she has one question for when I am reading these things, when you can give the answer. Can you share your common techniques, what you use in a group therapy with children? Sabiba, she asks this question to you.
So much depends on the culture and the age of the child. But like I said, I provide structure. You have a check-in where you check in with the children. I might tell a metaphorical story and give them ideas about a solution. I will have some expressive techniques such as drawing. I also like using theater, either improv or theater of the oppressed, where you have a situation and then they come in and change it, the action. I also, you can teach mindfulness techniques. Yoga is very good for children. What else? Yeah, those are some of the things. I also use cognitive behavioral techniques such as relaxation, problem
Mhm.
solving, teaching problem solving, um, looking at thoughts, how to change negative thoughts, because most people think thoughts that feelings aren't created by thoughts, so that's often helpful as well. And I also try to provide positive activities and have a good rapport with the children. So you get to know the children. Maybe you also do a home visit to see the family situation. But each group is different. But that's that's an outline that
Mhm.
we can do.
Okay.
And I also, I try to incorporate, like I said, the things from their home, whether it's songs, stories,
Hmm.
metaphors, whatever.
Okay.
Celebrate their holidays, even. But the main
Okay.
thing is that they have
Yes.
fun as well.
Uh, yes. Thank you very much. When I think Sabiba, you got your answer. Actually, what I understood, this is the thing, like how we can introduce different techniques. This is not like for children. It should be very structured psychological therapy, not like this. But everything can be worked, like mindfulness practice and also yoga. Where I am interested a bit know more about, like for children yoga, how they are taking, because like there are some controversy for yoga techniques. Some communities, some people are not willing to accept, or they don't think like yoga is giving you good healing or like this. So how did you see when you worked with them, and what is their impression, especially for the children and also for that community? If you can give us some example. Mm.
Okay, well, I think you need to one explain to people what you're doing
Mm-hmm.
and why it's beneficial. Like in the US, yoga used to be esoteric and now everyone does it because
Mm-hmm.
it's good exercise. So maybe you
Mm-hmm.
call it stretching, or maybe you call it exercise, or maybe you call it something else. You don't need to call it yoga. Or maybe you call it, I don't know, you can't dance, the Rohingya don't dance, but you find a way in their language to describe it, and you also describe it. You talk to the community leaders about it. Like this helps children when they're stressed out, when they're angry, to calm down. But yeah, you don't have to call it yoga. You could call it stretching or physical exercise, or you know, yeah, you be creative.
Part, because sometimes like nowadays, as you already mentioned, in your US everyone is practicing, and also all over the world people are now learning yoga. Is not only the exercise, it's giving us like everything. It's a healing our tension, and also it works for our mental health problem and disorder. It's giving us like calm and cool, and also it's reducing our pain in body. So everything it works, but this actually your suggestion is to actually introduce with them according to their context how they can take. So we have to understand this thing, because I had the similar experience. So we tried to implement for the Rohingya refugee women, and at the beginning it was like okay, they were laughing and they were rejecting, but later on when really they understood, yes, it helps. So that time then they started practicing, and they started motivating to others as well. So yes, this is difficult still, I think, but at the same time we can approach, and we can introduce them in a different way. As you mentioned, we can give them different names, because for yoga also they are suggesting the same relaxing and also breathing exercise. What we do as a mental health stuffs also, we are continuing these things. So thank you, Wen, for this answer. I think it will help for also for others who are interested to work with children, and different techniques we could learn from you. Might be we can give the different name like mindfulness, yoga, and storytelling, drawing, and also like to tell their share their experience in creating safe space. Everything can be helpful, like to serve the children PSS. Thank you, Wen. But now I am going to ask, especially you have already mentioned the psychological first aid. So I want to know, like for the children, how does it work for the yes, child psychological first aid? Do you involve directly for the children or the caregivers? How you applied this thing?
Well, psychological first aid for me is just good listening skills and crisis intervention.
Mhm.
So I did, like when I was in South Sudan, I trained all the volunteers, the gender based violence people, all the staff in psychological first aid, all the helpers, because it's just basic mental health skills. It's just listening. And listening is probably the most valuable tool psychologists or mental health people have. And it's also the hardest to just listen without trying to solve the problem for the person. So
Mhm.
for me, it's a point of view psychological first aid as well, because it really respects the person and tries to develop their own resources rather than the expert. So
Mhm.
I've trained all kinds of people in psychological first aid, but mostly I trained workers and volunteers from the culture because
Mhm.
they feel more comfortable talking to their own people and in the language. So that's been useful. But like I said, for me it's just basic mental health skills. I mean, I can give you an example. I did a training in South Sudan, and this woman walked through the health center, and this woman came out of the tent crying,
Mhm.
and she used the psychological first aid training to find out what happened. Her children had died, unfortunately, and then she connected her back to the doctor or nurse in the center. So that's important. That person probably wouldn't have made that connection because they were so distraught if that person wasn't there. So the idea of behind psychological first aid of connecting people to me to their larger community or their larger helpers is really important and is
Mhm.
much very important in refugee context because the Rohingya was very interesting. I don't know if it's still this way, but we were not allowed there at night. We were only there during the day. And as we all know, most problems happen at night. So it was really
Mhm.
important that we had a group of trained volunteers who could go house to house if there were problems. And there were lots of problems at night with um, radical groups, abuse,
Mhm.
whatever. So it was really important. And it was really important also to make sure we could connect with those people at night in case they needed support, where we used WhatsApp.
Mhm.
So that's the other amazing thing now is we have all this social media like WhatsApp, and we can connect to people and give them messages through even when we're
Mhm.
not there, because everyone nowadays has a cell phone. So
Yeah.
finding ways to use technology, I think, is also really important.
Mhm. Yeah. Thank you. And dear viewers, this is another very important point. Like, if we want to implement child psychological first aid, first we have to train actually the group of community people or the first responder from different organizations, community volunteers, because at the end of the day, people are living that
Mhm.
place, because people who are serving, we all are who are working for that community, we are not staying in night. So in night, all the people, community people, finally will be there. So they should know how to provide support, and especially as Wayne mentioned, like the psychological first aid, it actually means like to listen from the people what is happening to them. So we have to understand this thing, and at least we can link them, because we need to link, we have to listen, link, and also look. These three principles we are following in psychological first aid. So for the children, if people can be trained, especially for the community volunteers or the community first responder, they can help if anything happening, like in night or in absence of the organizations, staffs, or other essential organization. At least they can send them in immediately in this clinic or in any other healthcare. It would be the first responder. So please keep in mind, like if you want to implement these things, or if you want to train psychological first aid for children, definitely you have to choose from the community people at the beginning. Later on, might be you can develop some alternative working modalities or the training for trainers or like this, but this should be from the beginning from the community. Thank you. When it really helps, I think, like people are learning from you how they can implement for this child MSPSS activities in a different community setup.
Can
But
I say one thing about probably
yes.
for me, the most important thing I ever learned was when I was in graduate school, and my child development professor said, the most important thing is that you remember what it was like when you were a child. So when I'm
Mhm.
working with children, I'm always thinking, what was I like at that age and what did I need? And for me, that's a real humbling and really positive way of looking at it because it really helps me connect with children.
Mm-hmm. Great, thank you. When like this is another tips for our viewers and also people who are interested to work with the children. This is the first thing. Like yes, we are working and we are adult, but at the same time, first we have to think like when I was a child, how did I feel? What could I do? And what was my needs and demands? So it will also help to develop a program because I have to be there. Like I have to go back in my childhood. Thank you, Pan. This is very, I think, very good and important tips for the people to develop this curriculum or the program. So thank you very much, Wen. Now, actually, I would like to know more from you. You have already mentioned you have worked many more areas and also different countries. So for you, you can give me like a difficult context and also how did you overcome this so that we can also learn from you this from your experience. Which one was the most difficult in according to your all missions, all countries? Yeah.
Um, Probably the best project I ever did or was a part of, and the most difficult was in uh, Congo Brazzaville. And it was right after the Rwandan genocide, and
Mm-hmm.
children fled from Rwanda and walked 3,000 kilometers to Brazzaville. And
Mm-hmm.
they were being held by former genocideers, people who committed the genocide. And these people were holding these children because they were getting aid for the children and taking it. So my job was to try to reunify these children with their families in Rwanda. And this was after 5 years. So that's probably the most difficult because everybody, there was so much propaganda about what would happen to these children in Rwanda if they went back. And of course, these
Mm-hmm.
people were also rebels working in Congo Brazzaville. So what we had two unaccompanied children centers. And unaccompanied children are children who don't have a father and mother. They're not living with their father and mother. So they were
Mm-hmm.
separated as a result of the war. And this one center was in Lukalela, which was really in the jungle, and you could only get there by plane or boat. And
Mm-hmm.
I went to the center, and there was this woman yelling outside the center, hysterical. And I said to the people in the center, "What's the matter?" And they said, "Oh, she's crazy." And I said, "No, she sounds angry to me. If What do you think she would be angry about?" So they told me she wants her children were in the center and she wanted to see them. Her children were like 3 and 4 years old, and
Mm-hmm.
she scared the children because she was actively psychotic. So I met with the woman and I said, "Look, I know you want to see your children." And I met with the staff and I said, "You can come and see your children whenever you want, but if they start to become afraid, you have to leave and come back when you're calm." So we did that, and
Mm-hmm.
it was working. And then she trusted me, and then I connected her with our doctor who got her on medication. And then I started letting her see her children more. And then I had hired a refugee person to be an in-home aide for the family to help them to make sure she was okay and that she was treating the children well. And that worked, and I ended up bringing her back to Rwanda to her family. And it was really interesting because she was psychotic, and her reason she was the reason the kids were in the center was because she tried to drown them in the Congo River. And when I asked her about that, or someone asked her because I couldn't speak Kinyarwanda, was she said my husband left on the river and I wanted my children to find him, so I threw them in the river. So
yes, psychotic symptoms are like this. They could speak these types of unreal statement. Yes.
And but if I hadn't have been able to connect with her and come up with an alternative way of looking at her situation, nothing would have changed. Because as you know, in many cultures, mentally ill people are highly stigmatized. And people just, try to ignore them or isolate them. So that's one example that comes to mind.
Thank you, Gwen. Yes, this is really very terrible story for us, and also this is very sad story, but at the same time this is a learning. It could happen anywhere when we are where we are working, especially for these mental health patients. Everywhere there are some stigma. People are not thinking in a right way, so their attitude, their approach could be different. But at the same time, as a MS faces staff or personnel, we should understand their mental state as well, like why they are doing this, what is the reason behind, so that we can treat them in an appropriate way. Thank you. And it actually really very sad at the story, but at the same time it is a great learning for us, because we who are working, we have also might have some different experiences in different contexts, different countries, but we are getting some sort of different experiences, especially for the children. This is not too easy, because at the beginning it takes time for their parents. They don't want to explore or express what is happening, or also they don't understand what is happening to their children. Most of the countries, there are some myth, like I don't know, like according to your experience, if you can give us like example, if you have these types of experience. Mostly like parents or the relatives or the community people are saying something like this is super natural, or something genie, these types of things when people are having mental health issues. Did you face these types of problem, or if you feel or if you get these types of cases, how did you handle these things?
I think the main rule of thumb is meeting people where they're at. So you have to explore with them. If you don't know their thinking, you can't help. And I can give an example. When I was in South Sudan, in one of the refugee camps on the border with Sudan, UNHCR noticed that girls, after they reach puberty, would develop a high fever and almost go into a fugue state where they would be like motionless and wouldn't remember. And then they take them to the hospital, MSF, and they would get better and wouldn't remember anything. So we found out that this condition had a name. It was called NAPSIT, which basically means seizure, and that it was a cultural illness that girls tend to have when they had to negotiate puberty. And they were living in a pretty strict Muslim culture. So, the solution usually was arranged marriage, which, they didn't want. So and then they didn't know what happened to these girls afterwards. They just went, they got better, and they left. But what we found out was that the girls were going to a traditional healer. There was a whole network of traditional healers in these camps. and
Mhm.
he was prescribing different things. And we went and sat with him, and it was really interesting. He had a gourd, and inside the gourd, he had um, feathers that were
Hmm.
stuck in pieces of clay. And he said, I will
Hmm.
let you watch me if you're pure of heart. And the way I'll find out if you're pure of heart is I will raise the gourd and feathers will stand up. So he did
Okay.
that, and enough feathers stood up. He said, okay, you can watch. So a woman came in with, I don't know what the problem really was. Maybe it was depression. I think she was
Hmm.
having problems in her family. So he twirled water in a gourd, and he said, the water is going to talk to me and tell me what the problem is. So he twirled the water and was humming a lot. And then he
Hmm.
gave the diagnosis and gave the woman some herbs and said, bring, you have to bring your family in to see me.
Hmm.
So you have to use what's there and use the beliefs and
Hmm.
be curious about it. And he was really a good therapist. He was using, he wouldn't say he was, but he was using different therapeutic techniques to help these people.
Hmm.
So I think you have to enter someone's belief system and find out and use it in your explanation of why things are the way they are. Because you
Hmm.
can't, if you try to tell them otherwise, you'll lose them. You're not
Hmm.
going to develop trust.
Yes, yes, from my experience, also the same as you already mentioned. Traditional healers are also therapists. If they don't do harm, because some practices are really very harmful, because sometimes they are pouring some paprika powder and something very terrible things. It actually harms, and sometimes they are beating and hurting. They are doing something different, but some traditional healers, they are really doing very good thing. This is not harmful, but at the same time, as you already mentioned, this is the belief system. For the community belief systems, they are believing it is helping, and really it works. So they are also the part of our support. What we try to do, especially when we try to implement any mental health and psychosocial support implementation program anywhere, then we also try to find out them, like traditional healers, what they are doing, what is their current practice, is it harmful or not. If we find, okay, this is actually not harming them, but people are believing, and belief is this giving them confidence, and also it's like going forward, so it is helping some, like in many places where we are working, especially in these crisis areas, we are not getting appropriate psychiatrists or trained mental health general physicians or psychologists. We are not getting them, so somehow we need to develop some structure, and traditional healers are also helping us a lot in this sense. But at the same time, there is a risk, as you mentioned, like some practices are really harmful, and also it is sometimes they are losing their eyes when they are pouring something, and they are beating and hurting, and it is creating another problem. So this is the another thing, but we are trying to make a support system, and also we are trying to using this community belief system. It also the part of our MSPS support, and also for children especially. We know, like for the adolescent period, as you already mentioned, the adolescent girls, they are the main affected in this part. So we have to be very careful to create that environment, and to breathing with this MA spaces support staffs, and also with these traditional healers. Thank you, Gwen. I think like we could know many more things from you today, and now I would like to know from you a bit more, like if you would like to ask something to me, or if you have anything to additionally tell to us, we are happy to hear from you. Yes.
I can give another example of using the local
Mm-hmm.
culture. When I was
Mm-hmm.
in Lebanon working with Syrian refugees, there was a lot of violence in the schools. And I worked with UNICEF, who was basically funding the schools. And I we didn't weren't allowed to interact with the people in the school. We weren't allowed
Mm-hmm.
in the school. We weren't allowed to talk to the teachers. So I asked my local people, how can we influence teachers in another way?
Mm-hmm.
So they said that the people that can influence teachers are the religious leaders. That they are the ones who they will listen to. So I talked to people in the head office in
Mm-hmm.
Beirut, and they said, "Oh no, you can't talk to them about violence and gender-based violence and violence in the schools. It's just not appropriate." So I thought about it, and I said, "Why not? What do you? It's got to be. Why wouldn't it be appropriate?" And I also had this idea that these were learned people, and that nobody wants to see people hurt. So I arranged a meeting with the head mufti of the region. Everyone said, "Oh, he won't talk to you, blah, blah, blah." So
Mm-hmm.
I went into his office. He had this big office. All kinds of people are waiting in line to see him. And he's, he's in the traditional clothes. And we got in there. And I started the conversation by saying, you know, I work for UNICEF, and this is child protection, and that we don't support violence against children. And I said to him, I'm wondering if you could give me some advice and quotes from the Quran that I could use to tell people. And he opened up. He was very excited, and he appointed another sheikh to work with us on this problem. But everyone said, "Oh, don't go to him, don't go to him." And you just have to. What did I have to lose? The worst he would do is kick me out of his office. But I knew, obviously, this is a very smart man, and he would. No one in their right mind is going to support violence, and it was good. He did. So using those beliefs, I didn't go in and tell him you can't do this. It's bad. I said, how can I? I asked him to help me, which is his role as a leader. And it was very positive experience, and people in the
Mm-hmm.
headquarters were like, wow. So that was one thing. Using what you have to enter people's belief system
Hmm.
and show that respect, and
Yes.
and ask them how they can help, because you want participation. You don't want to be in there rushing in there as the savior. You want,
Hmm.
that doesn't do any good. You want the community to learn to solve, and the person to learn to solve their own issues.
Yes. Thank you, Gwen. I think okay, our viewers, they have learned a lot from you. This is the thing, like if you want to get a positive vibes or you want to implement your program, first you have to ensure the participation of the community, and also you have to accept the community belief system so that they can learn and also they can feel this ownership of the program, and they can also be supportive for you. This is the main thing, like what we know from when today. So we are going to end this program, we almost, but before going to end, and also when, thank you very much, you have given us time and we have learned a lot, and also hope like our viewers, they have also learned a lot, because this is a journey for, we are telling global mental health journey. This is a 4M initiative, so we are trying to invite every week in such type of like mental health celebrity who have glorious past and who are already working in this ground, so that people can learn and people can be motivated. This is an interesting part, like we learned a lot from you, how to, at least from the beginning, beginning. Today I will say, like, I have learned a lot to start a program for this child MSPSS program, how to implement, how to select the people, how to go to the people, how to involve traditional healers, how to involve community volunteers, and also the community participation. And then for the children, the group participation is very important, whatever you have mentioned. And also for the children, the different techniques you have mentioned, this is not rocket science, this is very usual techniques, what we can do it. Because we have to just think, we have to go back in our life, like when I was a child, what could I ask in this situation, what could my need, what could be my demands. So we have learned many things, and at the same time, I think, like, our people, our viewers also, they have got many information from you. Thank you very much, Wayne, and we are lucky to have you. Hope in future also we will get you as well.
Yeah, thank you very
um,
much, Mahmuda, for inviting me. I really appreciate it, and it's a pleasure. And I'm always available for support.
yeah, and thank you, Wayne. And also, yes, dear viewers, you have seen this program, and I hope, like, you enjoyed a lot and you have learned a lot. So if you would like to connect with our channels, you can communicate with us. We are in Facebook, we are in YouTube, and also with other social medias. You will find us. So if you want to get our contact, you will find in this scroll we have our contact number, and also we have our email. You can also email us info@4mtvusa.org. You can email us. We are always be happy to communicate and also to be connected with you. So now I am going to end this program. Thank you very much. Thank you all. Hope see you in next week in the same time, or also same day, with another guest, and we will also continue learning. Thank you very much.